Today, going to be doing the neurological assessment today on our patient. So we've been called to a patient who is confused and delirious. So we've got there, we've done our scene safety, our PPE, all those things. So we're going to go in, see with the AVPU score. So as we can see, our patient is alert and talking to us. We're going to move on to the see if our patient is fast positive and possibly having a stroke. So we're going to go through the face. Is there any facial drooping? We can't see any facial drooping. The patient can smile and there's nothing weakness on either side. We can look at their arms. We can get them just to squeeze both their arms, make sure they're both working the same, or we get them hold out our arm, make sure none falls down. That would be considered positive. We can get them to tell us out their name and their address for speech to see if their speech is slurred. And then if they are, we're just noting the time that it happens because it is a time critical thing. So a patient here isn't fast positive, so they're not having a stroke. So then we're going to move on to the A, E, I, O, U tips to make sure that the patient, to rule in and out any of those things and any of those tests they might need to do to go on from there if they are. So A, alcohol, so we can always smell alcohol. We can always ask them if they've taken any alcohol. E, epilepsy, we can usually see if they're having a seizure. We can ask the mum and dad. Insulin, the same, we can ask and see if they are diabetic or not. We can also tell by their glucose levels. Urea, we can not really test for that, but we're not really going into that. Trauma, again, we can ask, or we can see if there's any injuries on their elbows from falling down or on their head, but there's not in this case. So psychosis or poisoning, again, we can just ask around whoever's around at the scene if any of those have happened. And then S is for stroke. So again, we've done our fast and they're not positive, so stroke's ruled out. We're then going to go do a BGL because a lot of the time when people have a high or low BGL, like a blood glucose level, they can experience delirious and be confused. So the idea is being between 4 and 8. So all we're going to do is prick the end of a finger, put it on, see what the millimoles are, and that'll determine our BGL. We can explain to our patient that. So we've done that. Our BGL is fine. It's 5.6, so that's considered normal. So that's ruled out for that. We'll then move on to our Glasgow scale. So I'm looking for eyes, motor, and verbal skills. So for the eyes, we're seeing whether they're open or reactive. So in this case, they are. The patient's looking at us as we're talking and moving. So that's 4 points. 3 points would be if they're when we speak, they look at us. 2 points would be if when we pinch them, they open their eyes so they're localized to pain. And 1 would be if they don't respond at all. So that's good for the Glasgow scale there for eyes. So that's 4 points. So it goes 5, 4, 5, and 6 points out of 15. And then move on to verbal. So see if they're going to be verbally active. So to do this, we can just ask their name, date of birth, and if they respond normal, that's 5 points. If they're a bit confused, that's 4 points. 3 points is if they use inappropriate words like, say, banana or something random like that. 2 points is when they just moan sounds or something along those lines, and 1's none at all. And then move on to motor skills. So that's just saying, yeah, like squeeze my arms. If they can do that, that's 6 points. If they don't, but they can do it to pain, that's 5 points. If we touch them and they flex away, that's 4 points. If we touch and they move towards us, that's 3 points. But if they have an abnormal movement, that's 1 point, no movement at all, 0 points. So that's out of 15. That determines whether they are having a neurological issue. And that's what the triage people ask when we go to hospital anyway, what their Glasgow score was. So that's a good thing to do. Then we move on to the pupil reactiveness because that can tell a lot about our cranial nerves. So we're going to use our little pen light here. So we're going to assess the pupils just by looking at them and seeing whether they both are there and they're reactive. And then we're going to see the pupil size. So based on this, we're going to look at the pupil size on the patient. And then we're going to look at their reactiveness. We're just going to flick it there and move it and see whether they move to our pen light. And then, so based on that, whether they're sluggish, whether it's normal, whether it's reactive. And then we're going to do a big H to see whether they follow the pen. Some people will follow the pen laterally and longitude-wise. But sometimes when they go to their peripherals, they don't, which can indicate an issue with their cranial nerve. So we do that. Cover one eye, go up and down, see whether they follow it. Then the next eye, see whether they follow that. That's a good reacting test. And then we move on to the additional tests. If none of them have come up with anything to indicate there might be an issue, we then go on to additional tests. Sorry, I'm running a bit late for time. So that is the Brunsky test, which is if they lay down flat and they tilt their head up like this, if their legs move upwards, that's a positive test. And that's like meningitis, or your meninges on the back of your brain. That means that they've been injured. Another test is the Keningi test, which is when if you have your legs up at a 90-degree angle and then you try and lift from the leg to the foot up. If there's pain in that, then that's positive, which also indicates the same thing. And then there's the Romberg test, which is when you stand up, close your eyes, and if you sway side to side, that is an issue there with the cranial nerves as well. But also going on to the cranial nerves that we do test for as well. So I'm just looking here at what their names are so I know. So number 2, 3, 4, and 6 are all eye movements, which we would have tested when we done either the Glasgow score or the pupil reactiveness test. The ones that indicate speech and mouth movements are 5, 10, and 12, and the rest we don't really test for their smell and tongue movements and shoulder shrugs, which we can probably really tell when we get there anyway, or we can just ask them. And that's it for the neurological test.